Hi everybody, this is Dr. Manny and AskDrManny.com. Today I'm going to show you something and explain a little bit about what a placenta is. Now I'm going to show you, get ready, what it is. This is a real placenta that just was delivered. Now, this is a placenta. As you can see, this is the umbilical cord which goes into the baby. Usually the umbilical cord has 3 vessels, 2 arteries and a vein. That's very important so that all the good blood goes into the baby and the baby grows. Now this placenta, this independent unit, is basically attached to the mommy in the uterus. And it is through this unit that the baby gets all the oxygen, all the nutrients, and the baby thrives and grows. Now a lot of times when we do ultrasounds, we look at the placenta aging, because as a filter, you can only imagine that it filters a lot of things that ultimately build up inside the placenta. That's why it is so important not to smoke, to eat right, to exercise, and maintain a very good balanced diet. Now the placenta has a shiny part to it, as you can see here. Okay, the baby lives inside there, and this is the membranes. You see, the baby lives in those membranes, and that's the covering that the baby is in with all the fluid. And the other part is attached to the mother's body, and it's attached very softly, so that in reality it's a very passive type of relationship, so that anything, medical diseases like diabetes or hypertension become quite relevant. As you can see, this is the part that is attached to the wall of the uterus. See, this is a nice placenta. It's nice and shiny. Doesn't have a lot of calcifications. It's the appropriate size. So the baby lives in this sac. Okay, lives in that sac, and with the umbilical cord. And this part here is the one that's attached to the body. Important organ. This is an organ of life, if you will, because it is really what maintains the integrity and the well-being of the baby. Diseases like hypertension, as I said before, diabetes, are things that could affect the growth of the placenta. But this is something that, as a doctor, we pay attention to, and you as a patient have to remember that the placenta is just as important as the baby is.